Our current lack of understanding of addiction leads to decreased levels of success in treatment. What we're doing is we're punishing the behavior rather than understanding why the behavior occurs. Dr. Shrumik said it shouldn't even be called addiction, but it should be called ritualized compulsive comfort seeking. And that the behavior is just as natural a response to untreated trauma as bleeding is to an open wound. When we understand trauma, we see that this is a far better explanation for addiction than anything else that we know of. When you have adverse childhood experiences, you have an increase in smoking, an increase in alcoholism, and having 6 or more of these adverse childhood experiences actually leads to a 4,600% increased likelihood of injection drug use. What we're seeing is that we're having a problem in one area of life, whether it's emotional, mental, or spiritual, and we're trying to treat this physically. When people learn to eventually deal with the trauma that they went through, they are actually incredibly likely to be able to control their behavior with or without actual substance use treatment. Only 20% of individuals that meet the criteria for a substance use disorder ever get treatment. But by far the majority, 90 to 96% of individuals that have these substance use disorders will eventually recover when they learn to deal with their childhood trauma. What we need to do is we need to change the way we look at this first and then enact a change. Like a sculptor looks at marble and sees a statue and then creates. Einstein was able to look at a clock and understand the concepts of space and time and write and explain the theory of special relativity. If we understand addiction as the need for trauma treatment, we open up the grounds for success. We would actually do better to stop treating any substance use and devote ourselves to trauma treatment. But the best solution would be a comprehensive treatment that treats primarily the trauma and then control of the behavior once that trauma has effectively been treated.